Are you considering surrogacy but not sure where to start? Have you started the process of trying to find a gestational carrier but hitting roadblocks and you're just not sure what the next step is? Today, we are going to review a step-by-step guide to surrogacy so you will have all of your questions answered. Welcome to Brave and Curious, the podcast where we do a deep dive into understanding fertility, reproductive health, and wellness with science and compassion. I'm your host, Dr. Lora Shahine, a double board certified OBGYN and reproductive endocrinologist. Let's stay brave and curious together. Today, I am curious about surrogacy. Surrogacy is an incredible way to build a family, but knowing where to start, what questions to ask, and which steps you need to do next can feel overwhelming. Today, I've asked the director of our gestational carrier program at Pacific Northwest Fertility, Mollie Huyck, to give us a complete step-by-step guide on your surrogacy journey. Mollie, welcome to the show.
Thank you so much for having me. I'm excited to be here
Yeah.
today.
Oh, I love working with you at Pacific Northwest Fertility. You've helped so many of my patients on their surrogacy journey, and I'm so excited for what the listeners can learn from you today. And what I want to start with is, what is the number one misconception about surrogacy?
I think the number one misconception that I see or that we see is that it's only for celebrities or for the elite. We see it in movies, we see it in magazines or media. And so I think that misconception often comes up right out of the gate for many of us that serve patients each and every day in helping them overcome that initial misconception.
Right. And people often think, like, I don't really see myself using surrogacy because they only see on the cover of Us Weekly or People magazine, these celebrities. And that ties into the other misconception that people are, just sort of doing it because they want to keep their, figure similar. They're worried about carrying a pregnancy and delivering, and that it's sort of, a flippant decision or sort of a superficial decision. And I can personally say for my patients, they often say to me, like, if I would give anything in the world to carry my own baby. Like, that's what I've always envisioned. And, it's not just a quick decision or something that is sort of afterthought. I think it's a really, really deep and heartfelt decision.
I absolutely agree. On my side, I see that as well, both from how I get to serve patients in the clinical setting, but also from personal experience. Often we have to mourn the loss of the opportunity to carry our child and accept and lean into gestational surrogacy as a way to complete or to be able to grow our families.
Yeah, absolutely. And then I want to be really clear, the difference between surrogacy and gestational carrier. Can you tell us the difference in that? I want the listeners to understand.
Yeah, absolutely. So often you'll hear language around traditional surrogacy and gestational surrogacy. How I often describe it to patients is traditional surrogacy is there is a genetic connection between the carrier, who also provides their egg, and the child that they're carrying. Gestational surrogacy is there is no genetic connection between the carrier and the gestational carrier or the gestational surrogate. And so often I describe gestational surrogacy as your bun and their oven as a little bit easier way to kind of wrap your head around what that process looks like between those two differences, which are significant. In most states, actually in all 50 states, it's significantly more complex, and many clinics do not do traditional surrogacy.
Yeah, I've never been a part of a family building process where there is a traditional surrogacy process. It's always been someone is carrying an embryo that was created by someone else's egg and sperm that turned into an embryo. The person who is pregnant and delivering the baby does not have a genetic connection. And I think that that's really important, and it's something that ties into another misconception, that gestational carriers can just change their mind and maybe want to keep the baby if there's not a genetic connection. And you really do a lot of counseling and work that we're going to get into in great detail in this podcast episode, that you really do protect yourself from that. That's another reason people get really nervous about the process, right?
Absolutely. And, I think too, gestational carriers often, as one of the requirements that we look for is that their family be complete. before they step into gestational surrogacy. And their goal is to help another family. And so very early on, we set that expectation so that even legally, and I know we're going to step into that too today, but even legally, that an intended parent can have the reassurance that the gestational carrier wants to help you complete your family or grow your family, and does not want to take the child home to parent that child. It is your baby to take home once they're delivered. So
that's great. And we're going to talk about so many more misconceptions and way to protect yourself. And it's just such an important topic. But how did you come to this process? What is your path to being where you are now, helping our gestational program at Pacific Northwest Fertility?
Yeah, I've been a nurse for a long time. Prior to working in fertility, I actually worked in health and wellness and product development. So something very different than fertility. Until I faced my own diagnosis of unexplained infertility and navigated about a decade of personal treatment for myself, and navigated the path of recurrent pregnancy loss and miscarriage, and ultimately needed to partner with a gestational carrier as well as embryo donation to be able to grow our family. And so there came a tipping point for us personally, where we said, okay, what's the safest way for an embryo to have the best chance of survival, to become a healthy baby, and for us to be able to become parents for the very first time? And so that is how we were exposed and learned about gestational surrogacy. And really through those pain points of the process, and if you will, often for many people that step into surrogacy, they go, there's so much information, there's so many steps. And you feel a little bit like you're hooked up to a fire hose of information. And so we navigated some of the pitfalls that I help patients navigate today through our own personal journey. And it really was the catalyst that said, there's an opportunity here to be able to help other intended parents that are just starting out and in the thick of their journey, and finding partners that can really be helpful and trustworthy and leaning into those. And so, if you will, they say, use your voice even if it shakes, and I think at the beginning, my voice really shook when I started to advocate for patients and tell my own personal story. But as time has gone on, it's created this space to be able to help and serve others. And once that fire was ignited, I never turned back. I've been doing it ever since. So I've been helping families about a little over 12 years now within gestational surrogacy, and I've seen a lot of changes in the last 12 years as well, from COVID to what we have now, and what's happening in the landscape.
You have such an incredible wealth of knowledge and experience. And I do appreciate your sharing your story. I think people, just like me struggling with fertility and doing IVF myself, I think it gave me a deeper level of empathy. And I think people can be a great doctor without having to go through IVF, but it is just a little bit different. And, when I'm often talking to my patients about how I think that using a gestational carrier is something to deeply explore, something that I really think might be the right next step for them, I feel so good handing them off to you to kind of start a discussion and often share. Mollie is dedicated to this. She's been doing this for many years, and she'll be really open with you about her own journey. And you can just see the tension in their shoulders kind of relax a little bit, because they're like, wow, I'm going to be talking to someone that's actually kind of been through this. And I think that just gives you a really deep level of connection and empathy with the patients that I just really, truly appreciate.
Thank you for that. I often share with your patients too. I say, I am an open book, both personally, professionally. There is no question that's off the table. If I don't know an answer, we're going to get one together, so that we can navigate that. But I think it's met in a place where I want all patients to feel safe and comfortable in sharing perhaps what they've gone through already to that point, or how they envision growing their families. And if that, tucks in gestational surrogacy, to be able to give them as many resources or as little resources as they feel like they may need throughout
Well,
this
and the
process.
comfort level to ask the questions that they might feel uncomfortable asking their doctor, which nobody should ever feel uncomfortable asking anything. But, there can be other things that are just really nice to kind of really talk to somebody who has such a wealth of experience and personal connection to it. So I'd love for people to understand if they were to come to you for a new patient visit, what are the things that you kind of naturally talk about in that sort of first visit? What are kind of big picture things that someone who's like, hey, Dr. Shahine said I should really think about using a gestational carrier. I don't know where to begin. Like, where do you start?
Yeah. So when I do a new patient consult, one, it's complimentary. It doesn't cost a patient to meet with me. And I really want to make sure that I'm able to meet a patient where they are. And so whether that be you're in the early stages of just starting to create embryos and considering gestational surrogacy, or you have embryos already created and you're ready to step into gestational surrogacy, I will be able to walk you through those steps from wherever feels most comfortable for you. With that being said, with gestational surrogacy, there are multiple steps of the process. I often view it as a marathon and not a sprint. And during our initial consultation, what I love to do is take patients up to the 1,000-foot view, and I'm going to give you the overview of what to anticipate and expect during the surrogacy journey. And then we can drill down into those areas where you as a patient might have more questions, want to learn more, need me to come alongside of you to provide more resources. And that can look like many different segments as part of that. And so kind of high level view, often what we're going to go through is one is, do you have a match? Do you have a gestational carrier, whether they're private or through an agency? What does the financial landscape look like for you? Do you need resources to come alongside of you to help you get across the finish line to complete your family? We're also going to talk about the legal landscape and what that looks like, and why do you need an attorney, and where do you find an attorney as part of that? We'll also touch base on escrow. What is escrow? What does that mean as an intended parent? And then lastly, what does it look like when you graduate from the clinic and what happens after that? And so we really will walk through each of those steps. And sometimes we're sprinting through those little segments, if you will. And other times it's going to take us a little bit to get through it, depending on how much information a patient might need or someone might need as part of that.
You talked about legal. I think that's really important to talk about how important it is to protect all parties involved. Can you tell, how do you talk to patients about why it's important to have a lawyer and kind of have a contract?
Absolutely. So a couple of things to know is that as an intended parent, the gestational carrier, between the two, a surrogacy agency often is not interconnected into that legal agreement. That agreement is between you as the intended parent and the gestational carrier, and if they have a significant other or a spouse or partner as part of that. And so that agreement is between those two, potentially or more parties that are into this agreement together. As part of that it's really important to make sure that legal is separate representation than your gestational surrogacy agency. That it's not within the same house, that you have legal representation as the intended parent, but also just as important for the gestational carrier to have their own legal representation. With the legal portion of the process, us as the intended parents also absorb that cost to cover that agreement for the gestational carrier. And so making sure that she has an advocate that can help her navigate that agreement, as well as you have your own representation, is really important as well.
What are big things that are included in the legal agreement?
Yeah, so a legal agreement is very comprehensive. Within a legal agreement, there's going to be everything from medical decisions, whether that be related to baby or the embryo, or related to the health or care of the gestational carrier. It's also going to outline compensation for the gestational carrier and what that timeline looks like, which feels different than when you go through the IVF process. On that, it's broken out often over the 10-month period of pregnancy. There's also going to be things that get tucked in that might be important to you. Often considerations that I see for patients that are wanting to add in additional pieces might be mental health counseling. It might be organic fruits and vegetables that they want to provide an allowance for. It could be for maternity clothes. It could be regarding lost wages, if there were anything connected around that. But it is a very comprehensive legal document that'll also talk about what happens in the event if your gestational carrier was loss of limb or loss of organ or loss of life even. Often gestational carriers have littles at home, and we want to make sure that they're also protected and their families are protected as part of this as well. So it's a very inclusive document. Often for me, it feels the part that's, if you will, almost the hardest, because there's negotiation that happens, I think, on both sides, which is why we really do encourage having solid legal representation with an attorney that has experience in third-party reproduction. I think that's an important note to highlight, not just any attorney, but someone that specializes in this field.
Yeah. And what do people say? Do you ever get pushback when they say, oh, but this is a compassionate carrier, this is my sister, this is my dear friend. I think we can skip the legal, fees or contract.
Just you saying it, I feel all of the hair on my arms.
I know.
You think it has a dual role.
Yeah.
It's to protect the intended parents. It's also to protect the gestational carrier. And even if it's a compassionate carrier, it is much needed legally to protect all parties that are involved, but also to protect the child and what that agreement is. Often it's a highly emotional, highly involved process. And having that outlined up front really does make that process, when those emotions, if they do get involved or more intertwined, it makes it very clear as a resource to be able to lean back against, both from a personal one, but also from the legal and financial aspects of that too, of what should happen and when.
Yeah, I talk to my patients about it's a way to have the really difficult conversations before you're in this difficult situation. So, you think about, oh my gosh, this person is giving me such an amazing gift. This is my sister. This is my best friend that's willing to carry the baby. Let's just focus on how amazing this is and what an incredible gift it is. And I don't want to bother them with all these worries about what could happen. But I think it's even more important, it's important at every stage, just to kind of clearly talk about things. And you just mentioned how emotional, or you mentioned a little bit about mental health in this process. So we also recommend that each person who's involved have individual counseling. Can you explain why we recommend that?
So as part of this process, intended parents, as well as a gestational carrier and their significant other or partner, are also going to go through what they call a psychological evaluation at the very beginning for all parties, but also counseling. On the intended parent side, we go through the psych evaluation, but then we also have an opportunity to talk with a counselor about how do you explain your child's birth story to them? What does that look like? How does that language feel? Do you have expectations around communication with your gestational carrier that perhaps you, even as partners, or you haven't even walked through on what that feels comfortable, how that looks and how comfortable you are in saying it out loud? It feels very different when we have that internal dialogue. The same thing happens on the gestational carrier side. They're going to go through that psychological evaluation as well. And not just them, but their partner or their spouse as well on that side, to make sure that they truly all understand what they're stepping into. And often, I may have mentioned, often surrogates have, or gestational carriers have, littles at home. And so as they start to see their parents' tummy grow, it can create questions for littles. And so it also creates that chance for gestational carriers to be able to craft language of what feels right for their family in describing it. Often littles, I think, get it better than most grownups in being able to describe it, but having that space to be able to work through that dialogue with, if you have a significant other or partner, or even if you don't. I mean, I think that that's also important to note. And being able to work through that, of finding language that feels comfortable for you, that you feel like you can adopt and modify or change to make it your own, as your family grows.
No, I think it's great. And when patients do push back on that too, like they feel, oh my gosh, there's so many appointments. I'm already doing legal. I'm talking to the agency. Do I have to do this extra sort of counseling visit? I really encourage it because I feel like, okay, it could just be maybe a one-time thing, but this is a journey. This is actually like a lifelong journey, right? And you might be feeling very comfortable and great with how things are going right now, but also you're going to connect with a counselor that is experienced with third party. And, in a month, in 6 months, in a year, if things kind of come up that you hadn't thought of or feelings or emotions, you have this connection with somebody that you can, talk about in the future. So I do absolutely appreciate, intended parents sort of feeling like, oh my gosh, we're layering on all of these appointments and different things and genetics and oh my gosh, testing and all this. But in the long run, we have been doing this for a long time, and we really just want every person in the process to be aware, get their questions answered, get all the emotions taken, into account. And so I do appreciate that's a part of our program.
Yeah, and I think too, sometimes to your point, if they've been meeting with a genetic counselor, they've met with you as the provider, they've met with even perhaps the donor team, and they're considering an egg donor, or they're considering a sperm donor, and we've layered in gestational surrogacy, having someone to be able to process those with, I think, or just even creating that space to allow for that is really important and impactful, I think, for all parties.
Yeah. We're going to get back to talking to Mollie and learning about surrogacy in just a minute, but I want to remind you how important it is to support the show. Follow the show wherever you're listening, whether it's YouTube, Apple Podcasts, Spotify. It really helps others find the show. I hope you're finding this particular episode valuable. If you know anybody that's thinking about finding a gestational carrier or they're on their surrogacy journey, share this episode with them because I want to make sure that they get this valuable information. Now let's get back to learning. I'd love to talk a little bit about how to help intended parents navigate agencies because I really encourage people to talk to you first before they just go and sign a contract with an agency because I feel like you are, because you are an independent person. Like we at Pacific Northwest Fertility, we do not have surrogates that we recruit, so we do rely on our patients either having a compassionate carrier or going through an agency to find a gestational carrier. And so I feel like you can be this sort of independent, person to, guide and sort of help patients. But you and I know, Mollie, that not all agencies are created equally. And there's some really important things to look for in an agency and red flags to avoid. So how do you counsel patients about that really important step?
Yeah. So right out of the gate, for patients, I make sure that they know that I'm going to give them quite a few options as well. I'm going to give them a list to start, and then key points that they can look at and encourage them to look for in any agency, regardless if it came from us or on their own. One of those is communication. Right out of the gate, we want to know that a surrogacy agency is communicative, that they respond to them when they reach out and they have questions, that they are responsive in that request, that they're transparent in their pricing, both from their agency pricing, but also from what their gestational carriers in terms of compensation may be asking for. An outline of expectations, that they have that up front so that as an intended parent what those expectations are for the gestational surrogacy agency and what they might look like for the gestational carrier or the surrogate also. Often those agencies that are great have this outlined up front. They often are going to provide you with a complimentary consultation to get to know them versus charging you for that initial discussion. They're also going to provide an outline of what a typical agency agreement looks like up front. They're also going to have recommendations around escrow partners or attorneys that they often work with. They're going to be able to speak to the demographic of who they serve, how many journeys they do a year, how many care coordinators or case managers that they have on staff. And they will be able to do that transparently as part of that. And I think for many of us that lean into surrogacy, I always encourage that agency meeting up front, partly because within the first 5 minutes, you go, okay, could I communicate with this agency for the next 10 months or 18 months or 24 months as part of that? So I think it's really important to meet with multiple agencies. And why I see so many agencies is perhaps because we each are looking for something a little bit different from agency to agency, and how we each receive communication or want to be supported.
Yeah, I love that. So communication, transparency, sort of clear expectations are really important. And just also that just kind of initial feel, like, is this someone, in a partnership that I want to work with over the next, it could be 2 years, like you said. So what are some red flags?
If an agency, a few red flags right out of the gate is if I hear an agency has legal action that's against them, as we can imagine, that we hear that they're unethical. Like, those two are big red flags.
Absolutely.
As part of that.
Yep.
Escrow funds are management in-house. It's really important for both the intended parent and the gestational carrier to have outside escrow.
And what does that mean, really quick, for people that are learning?
Yeah, so an escrow is where often as intended parents, we will have to what's called fund an escrow account, which means we need to put the amount of what our surrogacy journey is going to cost into a holding tank or a holding account, bank account. And so it creates that ability for you as the intended parent to be able to see what are those transactions or events that are occurring, and how is that leaning against the legal agreement that you've put into place, so that there's transparency both from the intended parent side, but also from the gestational surrogate side, to know when they're going to be compensated and when things will be approved as well. So it creates a safe, transparency financial bucket that really should be managed outside of an agency, because your agreement is between you and your gestational carrier, not between you, your gestational carrier, and the surrogacy agency. So making sure that there's not a conflict of interest by having that also housed inside.
Got it. So just escrow is a way to protect all parties. So the money is held by an outside structure that is making sure that the money is there to pay the gestational carrier, and making sure that everything is transparent. And a red flag for you is if the escrow is tied up with the agency. And honestly, I had Dr. Brian Levine from CCRM and Nodal Surrogacy on to talk about the really difficult situation that happened in Houston, where it's exactly what you're talking about, where a surrogacy agency had escrow tied up, and that agency was using it in a lot of different ways, and money was honestly lost. So,
absolutely.
I really
and even
appreciate
personally, as I shared, like, even personally, for me, the agency that we had partnered with back then, there was risk of those funds going missing because they also managed the funds in-house. And trial by fire, you quickly learn that lesson. And if we can help mitigate that for others, it's so important.
Yeah, thanks for sharing that. Okay, other red flags in looking for an agency.
Yeah, I would say, another red flag for us is around medical screening. Is, often agencies, the ones that we work with that we find that do really well and are really great partners, come with everything provided as it relates to the surrogate's medical history or their records. When there are red flags for us is when the surrogate has a history of a high elevated BMI, preeclampsia, gestational diabetes, all condensed into one. And they haven't done that evaluation, one, from the safety for the gestational carrier, but also if they're even eligible to be a surrogate, and is it healthy and safe for her to be able to carry a surrogate pregnancy.
It's so hard because sometimes, people are matched, they find somebody they connect with, and none of the medical history has been done. And that's just so devastating. You feel like you finally found your carrier, right? And then, we come in and we're like, oh my goodness, this person, has had really complicated, tough pregnancies and deliveries before. That's a red flag that it could be a complicated pregnancy in the future. This person does not seem like it's healthy, or safe for them to be a carrier. And if the agencies could screen a little bit more, it really saves that sort of stop and start kind of process. Is that what you're saying?
Yeah, and often we want to do the screening ahead of time. When we look at this process, there are a lot of peaks and valleys that happen, or sprints that happen within this. And so if we can do the medical review for the gestational surrogate up front before an intended parent meets them, it often helps with that process, even emotionally, because we often really like them by the time we meet them. There's some similarities. And so providing that comprehensive review is very important as part of this as well.
That's great. I talk to my patients sometimes about a red flag for agencies is just feeling like it's a hurry. Like, oh, we've got all these, gestational carriers waiting for you. But they're going to go really fast unless you sign up with us and give us like a big deposit. I feel like that sort of sense of urgency, almost like like a car salesman kind of pitch on that first one. I feel like that is a little bit of a red flag. Like, you are excited. You do want to find a carrier. You are excited to build your family. But when the agency comes at it without a lot of what you said, like transparency, communication, kind of setting expectations, and they really want you to sign up sort of with a pretty big deposit, and do it quickly, so you're kind of like hooked in. I feel like that's a time to sort of pause, talk to Mollie, get your questions answered. Do you agree?
100% I agree. I mean, even just you saying that, I go, oh, it's so gross.
Yeah.
My initial knee jerk is that.
But our families are so vulnerable, and they're just so excited to start their family, and they are meeting with someone who, seems to have the same goal that they do and seems to have a solution to their problem. But yet we just need your money to like move forward. And I totally appreciate from the agency side, of course. I mean, it is a lot of work what they're doing. There has to be deposits. And I know it's sort of a nuance, but just that first visit urgency, give us your money, like just pause for a minute and really think about it, because it's easy to fall into that.
And I feel like the partners too that we work with in the agencies really do understand that it's okay for an intended parent to talk with 1, 2, 3 surrogacy agencies to be able to feel like they found the right fit as part of that. And then on the other side is making sure that they have that, they feel that connection with their agency. A patient is with us for about the first 9.5 weeks of that surrogacy pregnancy, and then they graduate from us. And so making sure that they truly feel that connection with the agency, because they're with them from week 10 on to the delivery of baby. And so I think that that's a really important moment to be able to pause.
Yeah. Just some other pretty common questions, and I think setting expectations. Mollie, how long does this process take? Like, if someone is speaking with you, like, when is their carrier pregnant? And I know that varies so many, but I think just to set expectations, is it months? Is it years?
Yeah. I would say plan for roughly 18 to 24 months.
Got it.
Are there nuances in that? Absolutely. Are there families that feel like they're motivated and want to do things in an expedited way, or even delay longer than that? Absolutely. But I would say on average, I say plan for 18 to 24 months with the average wait time tucked in there, and you quickly add in 10 months of pregnancy. Even on an expedited track, we're right at that 18-month point from today forward. If you're looking at surrogacy,
because it's logistics, and it's meeting, and it's finding the person that's the carrier, and the legal and the counseling, and whether you've created the embryos that are going to be transferred or not. And then it really starts to add up. I think that's really important for people to understand.
And often that timeline, we'll talk about that too in that initial consultation of what does that ideal timeline look like for you. Often I talk with patients, they say, we wanted to be parents yesterday. And others say, well, we just want to focus on phase 1, and then we're considering surrogacy for phase 2. More than anything, again, it's just meeting patients where they are and being able to help be a liaison or a facilitator, if you will, as part of that process.
Wonderful. How about cost? I think that's really important to set expectations.
Yeah, I think that's the piece in the room that that's the most common question, I think, right out of the gate that people ask. Now I say plan between $200,000 to $250,000 for a surrogacy journey.
Wow, Mollie.
Yeah.
Yeah, and that is not including creating embryos. Is that correct?
Correct.
Yeah.
Yeah. So that's the average of what I see. I think that's why we've seen an uptick in compassionate carriers on that side, and also other partners that we work with that offer more a la carte type of services or matching services, all the way up to more individualized or personalized expedited matches. There's the word I'm looking for. Expedited matches on that side. But I think for any of us, we go, okay, how do you afford to do
that
this?
was my next question. Are some pieces sometimes covered by insurance?
Great question. So often, a couple of questions that I'll ask during the consultation will be, do you have a family building benefit that we should note? Depending on an employer, they may offer benefits toward either IVF or medical treatment and or gestational surrogacy. So knowing that for many, especially in the area, is a game changer for those, especially as we start to see agency fees increasing nationally and base compensation for surrogates increasing nationally. If they don't have that, it's also where do they go for resources around financing? What does that look like? On that
and
side
how are people getting creative and finding ways to make it work? I think it's just such an important thing. It feels really daunting. And also, I just want to be sure, like when you say 200 to 250, so does that include, the compensation to the carrier, the insurance, the escrow, the legal, the counseling fees? Like we've talked about so many different pieces that what I don't want is to give a number and that not be inclusive. So is that an inclusive number?
That's an inclusive number.
Great.
And there are things within that number that I'm going to call it a big ticket item, if you will. A couple of examples would be health insurance for a gestational carrier, whether they have what we call a surrogate-friendly insurance policy or they don't have a surrogate-friendly insurance policy. As intended parents, we cover that cost for that insurance policy to protect that pregnancy if they don't have that coverage. And so that in itself is one example of kind of that larger number that gets tucked into that overall number. Another might be demographic of where the surrogate resides. Is she in the Pacific Northwest? Is she in Southern California? Is she in the Midwest? Those three regions in itself have very different base compensation, and for intended parents can mean a difference between $20,000 and $40,000 as part of that.
Okay, thank you for clarifying that. Mollie, this has been incredible, and I cannot thank you enough for, well, first of all, the care that you give the patients at Pacific Northwest Fertility and my own patients, but just how much you've shared today about expectations and kind of really starting on that surrogacy journey. Just thank you so much for being here.
Thank you so much for having me. I think more than anything, it's just a joy to be able to support and help our patients navigate the waters and help their families grow. So thank you so much for having me on today.
Absolutely. And we're going to have you back because I have so many more questions to ask you. So I hope you can come back again and just answer some more questions because you're just a wealth of knowledge.
Absolutely. I look forward to it.
Okay, great. I hope you found this episode valuable and learned a lot from Mollie. I know working with Mollie has helped so many of my patients at Pacific Northwest Fertility, and she is just a wealth of information. Be sure and rate and review the show wherever you're listening. Be sure and follow so you don't miss our weekly episodes all about reproductive health. Find this episode and all others at my website, drlorashahine.com. Thank you to Shannon Perry and my producers at Audiotocracy for creating another amazing show. And until next week, stay brave and curious.